Well, the government shutdown remains here. It's day 22, with Congress still at a standstill over a budget dispute. The government shutdown became the second longest federal funding lapse in U.S. history. Right now, there is no vote to reopen scheduled today after the 11th vote failed on Monday. The Democrats' main sticking point here is they want to extend enhanced premium tax credits, which are set to expire at the end of the year. This is the Affordable Care Act, also known as Obamacare tax credits. If no deal is reached here, millions of Americans who buy their own health insurance could soon face major premium hikes. 11 Live's Marissa Sarback spent the day talking to an insurance broker about what this could look like, Marissa, for people here in Georgia.
Yeah, Faith, the ACA marketplace doesn't open for selections until November 1st, but Georgians can now review options. The ACA marketplace is used by people who don't get health care through Medicare, Medicaid, or through their employer. Some are unemployed, others are small business owners, others contract workers. About 24 million Americans use it.
A family making $250,000 a year with a family of 5 is currently paying $16.92 a month. Their premium is going to go up to $31.12 a month, which is $17,000 a year, over $17,000 a year.
Julie Benvenisti is an insurance broker in Georgia, helping clients navigate the massive increases they're seeing on the ACA marketplace for 2026. She's also experiencing it in her own family.
Eli here, his premium is $450 a month, and he's going to increase to $665, which is really a 47% increase.
Eli is Julie's son, who is just starting out as an entrepreneur.
I'm 22, and I had a full-time job for a while where health insurance really wasn't a concern because my employer was either paying for it or compensating part of it.
Now he's learning about his new potential premiums.
It's an expense that I'm not ready to pay for. And, I definitely think I'm going to have to rely on my parents financially to be able to afford such an increase in health insurance when I am an entrepreneur just starting out.
KFF, an independent research group, predicts these premiums would more than double for some Americans in the ACA marketplace.
We're starting to get a good sense of what premiums for 2026 are going to look like, and they seem to be relatively in line with what was proposed earlier this summer by insurers. They're experiencing sticker shock right now. They're really going to start seeing their budget for next year be really affected.
Julie now has to prepare her son and her clients for what's likely to come.
First, I ask if they're sitting down. I'm serious. Many of my clients have said they're just not going to be able to be insured, and they're going to go without coverage.
Now, again, enrollment opens on November 1st, and if Congress comes to a decision to end the tax credits before the end of the year, we would see those numbers change. Faith?
All right, Marissa, thank you so much. Now, we did reach out to the Democratic Party of Georgia and the Republican Party of Georgia for a response to the rise in health care costs. A spokesperson for the Democratic Party said, quote, Republicans like Representatives Buddy Carter and Mike Collins would rather refuse to show up to work and keep the government shut down than extend critical ACA tax credits for Georgians facing skyrocketing insurance premiums. Georgians cannot afford Carter and Collins' harmful agenda of ripping away affordable health care and jacking up prices. We did reach out to the Republican Party, but we have not heard back yet.